to oppose the cut motions towards the demands number 47 on Goa Medical College, demand number 48 on health services, demand number 49 Institute of demand number 49, demand number 51, demand number 53. Total all the demands. So Speaker sir, firstly, काल आमचे भाशेन बजेटां उलयल्ले capital outlay, Speaker sir. Capital outlay is where we have to invest, and one of the line items of capital outlay investment is investing in health infrastructure. आणि आज जरी तरी चोयल जाल्यार besides GMC, whatever we have seen, the good work that has been done by the Honorable Health Minister, by the Chief Minister at the GMC, rest all other sub-health centers, the PHCs are lacking of investment of the capital outlay. ये पैसे जे आज गावांत PHCन सब-health centeraंक घालपा जाय ते आज मिसिंग आहे. स्पीकर सर, हांव स्पेसिफिकली मुगेले कॉन्स्टिट्युएन्सीचे डिमांड्स हाचेर हांव उलयतलो आनी स्टेट स्पेसिफीक उलयतलो. मुगेले एरियाज ऑफ कोलवा, बेनावलीम आणि सेरावलीम हे जे सब हेल्थ सेंटर्स आहे ते कंसावलीम PHC अंडर येत आहे, आणि वारका, ओर्लीम, कार्मोना आणि कावेलोसीम जे आहे ते चिंचिणी PHC अंडर येत आहे. स्पीकर सर, चोवपाक गेले जाल्यार हे सगळे सब हेल्थ सेंटर्स अपग्रेड करपाची गरज आहा. स्टाफ शॉर्टेज आतांय आहा. 6 म्हयने पयलीं हांव असेंब्ली उलयल्लो तेन्नाय आसली, आनी म्हाका भिरांत दिसता की 2027 देखून हीच स्टाफ शॉर्टेज उरतली काय म्हणून हांव रिक्वेस्ट करता हेल्थ मिनिस्टराक, ताकी हांव 6 म्हयने पयले हेच स्टाफ शॉर्टेजीचेर उलयल्लो. हांव रिक्वेस्ट करता कोलवान 1 MTS, 1 RMD, 1 ANM, सेरावलीम 1 ANM, 1 MTS, बाणाले CMO शॉर्टेज आहा, 1 AHO, 1 ANM, वारका 1 MTS to be revived as it has already lapsed. Sub-center Carmona 1 post of MTS again has to be revived. Sub-center Kavelosim 1 post of health worker male to be revived. So हे भाशेन हे पोस्ट आम गेलते पाटी सांगलोले, आतांय सांगता 2027 देखून हांव सांगत रावतलो स्पीकर सर, जाल्यार आनी हे उलयन कसो फायदो डिमांड घालून. So I want these demands of these staff to be fulfilled, and we would want locals to be given a preference, qualified, eligible locals. So हिंगा जे demands आहाय ते demandsant म्हाका दिसता हे staff shortage जी आहा ते जावपाक जाय. Secondly, Speaker sir, when it comes to ambulance, 108 ambulance बाणाले पंचायती कडेन भायल्यान आसता, पूण ती राती कडेन पाक केलो आसता. दीसभर केन्नाय गरज पडली या रातीको देखून गरज पडली जाल्यार ते एम्बुलन्सी सर्वीस आमकां आमगे कॉन्स्टिट्युएन्सी मेळना. हे हांवें पॉयंट आय हॅड ब्रॉट इट टू द नोटीस, एंड आय स्टील थिंक दॅट दीस हॅज टू बी रिझॉल्वड. द बॉल गेट्स पास्ड, बट ही एम्बुलन्स आमकां अवेलेबल ना स्पीकर सर, आनी वी वूड वॉन्ट दीस एम्बुलन्स टू स्टार्ट working only for us, because it is kept only for us for our constituency, Speaker sir. Speaker sir, when it comes to upgradation, हर्स वॅना गरज आहा स्पीकर सर. आमगे 7 विलेजींक आमकां सपोर्ट मेळना. एक हर्स वॅन घालची म्हूण आमगे विलेजींक 7 विलेजींक सपोर्ट करपाक, and that can be made stationary near any of our sub health centers to be made available to all these. I think this is one of the major thing that will help the entire constituency, and I would want the Honorable Health Minister to help us with this hearse van before the end of this financial year, that is 31st March 2025. जाच पयले आमकां hearse van हाडपाची गरज आहा. स्पीकर सर, आज हांव हिंग उलयता आसतना I would like to thank the Honorable Minister. 2 वर्स जालीं हांव हाटीर लागोन एकूच सद्या मेळ्ळ्या, which I am happy, and we are going to inaugurate, is the dialysis unit. कार्मोना आमगे सब हेल्थ सेंटरान डायलिसीस युनिटाचें काम ऑलमोस्ट क्लोज टू कंप्लीशन जाल्लें आहा. वी आर जस्ट एक्सपेक्टिंग 1 जनरेटर, एक 3 phase कनेक्शन आनी एक उदकाची टँक, एंड देन वी आर लुकिंग एट inaugurating that sub-health center on completion of this assembly session. So I would really like to thank him and his team. But along with this dialysis unit, there is also a commitment which was given to open up an emergency care center, ECC, same at the Karmana location, along with a pathological lab included in the same premises. I have already moved a note, kala honorable CMA kade ulillo, then sangila to NOC ditlo, in order to build that on CSR inside the property of the education department, where the government primary health center. So I would request the education department to give me this NOC, and I would request the health minister to start this work of ECC. So at least by December 31st, we have the emergency care center. So we have surplus time to move our files and to get our things organized. And I think this will be the major achievement of the constituency once we have the ECC along with pathological lab and the dialysis center up running for the locals. Speaker sir, आमगे constituency dental facility government आडनी सो कांयच ना. आज आम बसदोलो आमी GMC hospital बसदोल्या every week in order to avail the services that the government is giving in GMC. So dental chair जोरी तोरी आमच्यानी आमगे एक sub health center आंग घालपा जाता. It can be either in the Benaulim sub health center or any other sub health center, but one dental chair. And I would like this requirement to be cleared and given to us by at least another 2 or 3 months before the end of monsoon. I'll follow up करतलो Speaker sir हेजेर. Speaker sir, community trust जो Speaker sir, तो community trust upgraded sub health centers increase केल जाल्यारू community trust वाडटलो. It will encourage individuals to seek healthcare services earlier. मुडचे आमकां आतां मोबरा पोंतार सोन सगल्यांक मडगांव वयचें पडटा Speaker sir. कोण ना Speaker sir गांवांनी सायसा 6-7 जाली no medical services available. दोतोर ना कांय सर्विस ना दोतोर Speaker sir. So we need this 24 hours emergency care center, which is the need of the hour. Speaker sir, आज आम चोयल जाल्यार 2-3 प्रॉब्लेमा मेजर वाडत आहे. एक डायलिसिस हा, which we will try to address once the dialysis center is ready. Speaker sir, दादली मनशांक आमकां सगल्यांक मेल जे आहे age of 40 and above जाल म्हणटरी there is a chance of prostate cancer जे आहा Speaker sir ते increase जायता आणि आमचो मोद awareness ना Speaker sir. So there is something called as PSA test, prostate specific antigen test. As awareness करपा जाय, ये PSA test should be made available at the PHC as well as the sub health centers. This is something I think I'm putting it down for the first time. I think this is something we have to start at grassroots levels. As a health centers I think galpa जाय, ताकि दादलो मुनीस 40 years and above can go and avail this test, and male doctors, male RMs should be made available in order to get this test organized. In women, Speaker sir, we are having breast cancer and cervical cancer on a very high increase. And Speaker sir, already we have spoken about PET scan. PET scan combined with CT scan is what is required in order to ensure cervical cancer detection. And ये PET scanचे जे machine आहा, then GMC हाडपा already proposal केलो. ते कोत्ता सोनात, since it is not there now, ते कोत्ता सोनात South Goa district hospitalanतूय ते machine एक हाडचें आणि ये जे awareness आहा ते local levelar सोन म्हाका सदा South Goa district hospitalan address जावपाची गरज आहा. When it comes to breast cancer, yes, I know that we have got a tie-up with UV can, आणि UV कॅनाक घेऊन आमी गांवांनी कॅम्प करीत आसा. पूण mammography unit at every PHC is an added value which will help our women in the community to come there. And a women doctor, yes, women doctor uch kota hai, and women doctor should handle this mammography unit at the PHC levels, because this will be another measure to ensure that community trust is built up. Community जो trust हा ये सब health centeraंचे वाडोवपाचो हो आनी एक measure आसतलो Speaker sir, हांव एक मोती हाडपा सोदिता हेल्थ मिनिस्टराले की वेल्सांव सब सेंटर आहा हो 5 वर्सां जालीं बंद पडलो आहा. भाड्या आसले शॉप, ते शॉपां चलताले आनी थिंगा बंद पडलो आहा. आय थिंक विथ द रायट MLA यू शूड टेक इट अप एंड यू शूड स्टार्ट इट. थिंगा जायत लोक आमचे बरोबर येता, आमगे जायत उडकी आहा, ते आमकां सांगत आसले. सो आय हॅव पुट इट डावन हियर सो दॅट वी कॅन गेट इट स्टार्टेड. स्पीकर सर, स्पीकर सर, आज आमकां एक ह्यूज शॉर्टेज जाल्ली आहा स्टाफाची. आनी तूं चोवपाक गेल जाल्यार आज जें आमगेलें PHC कन्सावलीम आहा, विच इज रिलेटेड टू माय 3 विलेजीस, थिंग सोद्दां सगळें सांगताय स्पीकर सर की हे दोल बिल्डींग बांदिलां सगळें बरें आहा, इन्फ्रास्ट्रक्चर सगळें आहा, भितर स्टाफ ना चलोवपाक. तूं जरी चोवपाक गेल जाल्यार एक्स्ट्रे युनीट आहा थिंगा, बट 1 एक्स्ट्रे ऑल्सो हॅज नेवर बीन टेकन. कित्याक स्टाफ ना. ते चलता, ते मशिनां वॉरंटी आहा कितें तें कांय खबर ना. अल्ट्रासावंड मशीन आहा पूण तें चलना, थिंग धुळमान वता कित्याक मनीस नाय चलोवपाक. सो हे सोजमीकाय मेळना स्पीकर सर. हे जरी तरी सॉल्व जालें जाल्यार चोय आमगेले भुरग्यांक कामां लावपाक मेळटा, सगळें मेळटा. सो आय थिंक इफ दीस इयर यू कॅन डेडिकेट टुवर्ड्स स्टाफ अलॉटमेंट, this year 2024-2025 start staff allotment to all your PSCs, all your sub health centers. I think this could help us. Specific requirements to wind up मुगे constituency, एक dental chair, एक emergency care center, एक hearse van आणि एक ambulance to be functioning on a regular basis are my specific requirements for the constituency for this financial budget. Speaker sir, yes सांगून I would like to end up these I would like to end up my oppose to the demands and support to the cut motions moved by me. Thank you, Speaker sir.
Shri Kedar Naik.